Hello, everyone, and thank you for being here. My name is Sharifa Khairunisa from BCS, and I am the project director for this initiative. So, what is this project all about? This project is about preventive healthcare and lifestyle medicine, a 3-day initiative that will be conducted at Shangri La Hotel. Let's start with some context. These are the top causes of deaths in Malaysia as of 2021, as analyzed by World Health Organization. As you can see on the slide, ischemic heart disease is number one, even beating COVID-19. So what is ischemic heart disease? It occurs when blood flow to the heart muscle is blocked by buildup like cholesterol and fat. The key point here is that it is preventable with healthy daily habits. Now, if we ignore COVID 19, which was an inevitable pandemic, the third leading cause is stroke. I have a few questions for you. Do you know what to do if you see someone having a stroke? What if they become unresponsive? Do you know how to perform CPR? This is the core of problem. Most people wouldn't know what to do in an emergency. This is why we have proposed a strategic plan to solve this issue. First, we will educate the community through engaging talks and on preventative healthcare and the power of simple daily habits. We call this the learn phase. Second, we will move from theory to practice with hands-on first aid demonstrations. This practice phase gives people the confidence to act in a crisis. And third, we will facilitate early detection through on site health screenings and a blood donation drive. This detect phase gives people a clear picture of their health status so they can make informed decisions. Now, let me briefly introduce our team. Let's start with me, the project director. As I've mentioned at the beginning. Next, we have the venue and logistics team, who are responsible for securing the physical location and all related operational needs. This includes Mehrun, the venue and operations lead, and Rahim, the logistic and budget coordinator. Moving on to our program and content team, who are responsible for the event's educational direction, securing speakers, and ensuring we meet our project objective. We have Malik as the program development lead and Farouk as the speaker and talent coordinator. The last team is schedule and programming, responsible for the flow and detailed activities of the 3-day event. We have Norain as the event schedule lead and Banu as the activities and programming coordinator. So why are we the right team to bring this vision to life? Our company, the Eventful Co, is a Kuala Lumpur based agency, but we aren't your typical event planners. We specialize specifically in the health and wellness sector. We see ourselves as a bridge. We understand the language of healthcare organization and also we understand the needs of the local community. Our job is to connect the two, making sure the vital health messages actually reach the people who need them. And finally, it's our philosophy that sets us apart. We don't just want to check boxes on logistics plan. We approach every project as strategic partners. For us, success is measured by whether we help make a real, positive, and lasting differences in the community's well-being. Now, I will let my team explain our plans in more detail. That is all from me. Thank you.
Before we build the solution, we must acknowledge the challenges. First of all, the lack of collaboration. Healthcare professionals, policymakers, NGOs, and the public, they all work tirelessly, but they work in silos, individual efforts. No matter how passionate, they cannot create a systematic change. We need a unified platform. Second, awareness is not an action. The public knows about the health risk. They know that diabetes is rising. They know heart disease is a threat. But knowing the risk and knowing how to respond in an emergency are two different things. Awareness without an action is just noise. Thirdly, logistical complexity. A 3-day event for 400 to 600 diverse attendees, this is not a simple gathering. It requires precision, it requires coordination, it requires a partner who understands scale. And finally, walking the talk. HealthFirst Global is a trusted name because it leads by example. The event itself must reflect sustainability. It must mirror the values we preach, reducing waste and using resources responsibly, and proving that health and sustainability go hand in hand. By solving all these challenges, we don't just host an event, we strengthen HealthFirst Global role as Malaysian catalyst for change.
Assalamualaikum. I am Abdul Rahim, the logistics coordinator and the budget coordinator as well. I will present to you the purpose of events. Our first purpose is to make prevention first as a priority. We aim to close the gap between understanding health and living in health in our community. Indirectly, this will reduce national burden on facing non-communicable diseases, NCDs. Second, we will aim to create early detection as a cultural norm. We need to reduce the social stigma towards health screenings, as we can personally experience that we might be scared to go into health screenings to check whatever is wrong with us. Thus, Well Nation aims to create a friendly and community driven environment to have health screenings in the event. Gotta remember, health screenings should not be optional, it should be routine. Lastly, it is for us, the purpose is for us to be a reference for health sustainability. The Eventful Co's core values of timely, ethical, responsible, and transparent event coordination should be an example towards other corporates that aim to reach the same thing. Next.
Hello and Assalamualaikum. My name is Muhammad Malaika Bezani and today I will be presenting our goals and objective for the Well Nation 2026 program. So our main focus is to promote preventive healthcare and encourage a healthier lifestyle among the community. So the first one is education on the 6 pillars of lifestyle medicines. The goal is to increase awareness about preventive healthcare. We want people to understand the importance of healthy habits, such as proper nutrition, regular exercise, stress management, good sleep, social connection, and avoiding harmful substances. So to achieve this, we will organize workshop and seminars with health experts, so participants can learn how to apply these habits in their daily life. So the next is early detection on risk assessment. So the goal is to help people understand their current health condition, because many people are not aware of issue like high blood pressure or high blood sugar. So our objective is to provide on-site screening such as blood pressure checks, BMI and blood glucose tests. Participants will also receive explanation and advice from healthcare professionals. And the third one is cultivating a culture of wellness. We want to encourage people to see healthy living as a shared community responsibility, not just an individual choice. So to achieve this, we'll organize networking session and wellness activities where participants can share experience and support each other in maintaining healthy lifestyles. So next is empowerment through practical skill building. The goal is to equip participants with useful skills to manage their health. So we will provide interactive learning stations such as healthy cooking demonstrations, meditation sessions, stress management activities, and ergonomic exercise. This allows participants to learn by doing, not by just listening. Okay, and last but not least is sustainable healthcare cost reduction. The goal is to show that preventive healthcare can reduce long-term medical costs. Our objective is to provide talks and presentations that explain how healthy lifestyle changes can prevent chronic disease and reduce healthcare expenses. So, in conclusion, our goal and objective focus on awareness, prevention, practical skills, and long-term health improvement. We hope that through this program, participants will be more informed, more prepared, and more motivated to live a healthier lifestyle.
Assalamualaikum and hi everyone. My name is Nur Nabiha. Today I would like to present our purpose event, which is a 3-day health awareness program focusing on prevention, education, and community well-being. This program is designed to promote health awareness, disease prevention, and personal responsibility towards health. The main objective is to educate participants on how to maintain a healthy lifestyle, learn basic life-saving skills, and identify potential health risks through early screening. In addition, this program also emphasizes the concept of sustainable healthcare. This means focusing on prevention rather than treatment, which can help reduce long-term healthcare costs. By maintaining good health, individuals can avoid stress, disease, and at the same time reduce the burden on the healthcare system. Overall, this program aims to provide participants with practical knowledge and skill that can benefit not only themselves but also their communities. The program will be conducted over 3 days, where each day focuses on a different aspect of health. Day 1 focuses on health, lifestyle, and prevention. Day 2 focus on emergency and life-saving skill, and Day 3 focus on health risk assessment and screening.
Okay, next I will explain about the sustainability focus of our event. So, the Eventful Co believes that a healthcare event should be also practice healthy and sustainable habits. So, Wellnation 2026 will include sustainability in every part of the event. First thing first is paperless event operations. All materials will be digital, so that participants can scan QR codes to access slides or any information. There will be no printed programs or handouts. This helps reduce paper waste and supports environmental sustainability. Next is waste reduction and management. As you can see here, we will provide clearly labeled bins for recycles, compost, and general waste. Also, all lanyard and name tags will be collected after the event reused in future programs. Next is responsible catering. We will use reusable or compostable food containers. There will be no styrofoam or single-use plastic. Buffet station will also help control portion sizes. This reduces food waste and encourage healthier eating. And lastly is energy efficiency. We will manage our air conditioning properly by keeping doors closed during sessions. We will also use energy efficient equipment, and all systems will be turned off during breaks to save energy. So in conclusion, sustainability is an important part of our event. We aim to reduce waste, save energy, and promote responsible practice. This ensures that our event not only talks about health, but also practice it. That's all from me. Thank you.
For this presentation, I will focus on Day 1, healthy lifestyle and prevention, with the theme Know Better, Live Better. The event will take place on 13 June 2026 at the Grand Ballroom, Shangri-La Hotel, Kuala Lumpur. Let me walk you through the tentative program for day 1. The day will begin from 8 a.m. to 8:45 a.m. with the registration session, where participants will check in and receive their healthy living passport. From 8:45 a.m. to 9:15 a.m., the opening session will introduce the purpose of the summit and highlight the importance of prevention in maintaining good health. Next, from 9:15 a.m. to 10:45 a.m., participants will attend the 6-pillar deep dive session, which covers key aspects of healthy lifestyle such as diet, exercise, sleep, stress management, social connection, and avoiding unhealthy habits. A morning break will follow from 10:45 a.m. to 11 a.m. The program will continue to 11 a.m. to 12:30 p.m. with the session Healthcare Dirty Secret, focusing on the risk of delaying treatment and the importance of prevention in reducing healthcare costs. After that, there will be a lunch break from 12:30 p.m. to 1:30 p.m. In the afternoon from 1:30 p.m. to 3 p.m., participants will join a live Q&A panel session to interact with speakers and gain further insight. This will be followed by an audience poll session from 3 p.m. to 4 p.m., where participants can reflect on one healthy change they plan to make. Finally, the day will end with a wrap-up session from 4 p.m. to 4:30 p.m., summarizing key takeaways. In conclusion, the program is designed to balance informative session and interactive activities, ensuring participants are both informed and motivated to adopt their healthy lifestyle. Thank you. Bye.
So my name is Banu. I'm from BCS, and I'm going to present day 2 of our program, which is Mastering Life-Saving Invitation. First aid training. This activity focuses on equipping participants with basic first aid and emergency response skills that are very important in emergency situation. For the objective of this activity are to provide participants with basic first aid knowledge and skills to help them respond quickly and efficiently during emergencies, and also to increase their confidence in handling real life situation before medical help awareness. And then during the session, participants will learn several important life-saving techniques such as CPR or cardiopulmonary resuscitation, amicable maneuver for choking, bleeding control, burns treatments, and the recovery portion. There will be live demonstration and hands-on training guided by instruction and the nation red crescents. Participants will also take part in an emergency response simulation game where they will apply what they learn in realistic situation. This activity will help participants become more prepared, aware, and confident in handling emergencies. Handling emergencies. And then for day 2 schedule, for day 2 the program start at 8 a.m. with registration recap of day 1. The next day will be an introduction to first aid by Dr. Azizul, followed by a live demonstration techniques. After that morning break, participants will attend the first aid demonstration of Nation Red Crescents. And finally, the day end with a reflection and discussion. And also at 4 p.m. we end of the session with the QA section. And next, I will continue with day 3 of our program. Day 3 focus on early detection and health risk assessment, which is very important to prevent serious health status or problem. For the objective, this activity are to increase awareness of participant health condition to help detect health risks early, and also to encourage preventive health practice. And for the on this day, participant will undergo on-site health screening supported by path lab, including blood pressure test and detect risk like hypertension. Health expert will also explain the importance of regular health checkup to avoid critical health issue. In the afternoon, there will be a blood donation drive where participants can contribute to help patient in need. Additionally, participants will join interactive activities such as Know Your Numbers and the Health Detective Challenge, which make learning about health more fun and engaging. This activity will help participants better understand health indicator and disease symptoms. This activity will help also participants indicate and diseases symptoms. And in conclusion, both day 2 and day 3 are designed to equip participants with essential life-saving skills and health awareness. On day 2, focus on emergency response and first aid, while day 3 empowers early decision and prevention. Together, this activity help participants become more prepared, responsible, and health conscious individually. So that's all for my part, and thank you.
Hi, my name is Muhammad Farouk Asri. So for our first speaker is Dr. Azizo. Is known in Malaysia for his effort in promoting public awareness about cardiopulmonary, which is CPR, and basic first aid. He is the founder of CPR Malaysia, an initiative that focusing on educating the public about life-saving skills and emergency responses. Through this platform, he has conducted many awareness programs, demonstration and training session to encourage more people to learn how to respond during medical emergencies. Okay, we're moving on to our second speaker, which is ST John. The first point is expertise and contribution. ST John's Ambulance Malaysia bring over a century of experience in first aid and emergency response, making them a highly trusted and professional partner for Well Nation 2026. And then the second is large-scale training setup. For day 2, they will deploy 40 certified trainers to transform the Shangri-La Ballroom into a structured, large-scale, hand-on training environment, ensuring smooth coordination for all 500 participants. And then the third point, effective and structured learning experience. Participants will rotate through skill station covering CPR, the Heimlich maneuver, bleeding control, burn treatment and recovery position, allowing personalized guidance while maintaining an efficient, safe and high quality learning experience without chaos. Okay, now our third speaker, which is Puan Sharifah Mazlina, nutritionist and wellness coaching. So the number 1, media presence and recognitions. Sharifah Mazlina is a well-known figure about Malaysian audience, having host popular programs such as Riang Bersama on RTM and Hidup Sihat on Astro, now in its 4th season. Number 2, strong academic and professional background. She holds a master degree in nutrition from Universiti Kebangsaan Malaysia, which is UKM, and is certified by the Nutrition Society of Malaysia, giving her solid credibility in field of health and nutrition. And number 3 is practical and engaging approach. With over 15 years of experience working with major organizations like Petronas, Maybank and Telekom Malaysia, she known for deliver relatable and practical nutrition advice, simplifying complex concept in everyday habits without making it feel overwhelming. Okay, for the 4th speaker, which is Datin Dr. Safura Sheikh, Health First Global Representative. Number 1, extensive public health experience. Datin Dr. Safura Sheikh bring over 15 years of experience from the Ministry of Health, where she contributed to policy development and major initiatives such as the National Strategic Plan for Non-Communicable Disease. And then the strong academic and leadership background. She is hold a medical degree from University Malaya and master in public health from Johns Hopkins University, and currently serve as Director of Community Outreach at Health First Global, focusing on bringing policy and real-world implementations. And then impactful of sessions. Dr. Safura will open day 1 by highlighting the importance of prevention in public health, deliver her message with clarity, authority and practical approach that avoid overly technical and language. Moving on to our speaker number 5, which is Professor Datuk Dr. Lokman Hakim Sulaiman, health economist and public health physicians. Number 1 is distinguished leadership and global experience. Professor Datuk Dr. Lokman Hakim Sulaiman is highly respected figure in public health, having served as the former Deputy Director General of Health, Public Health in Malaysia, with additional experience at the World Health Organization in Geneva, and currently as a professor at IMU. And then strong academic and throughout leadership, with over 150 peer reviewer publication and recognitions as the TED speaker on the economy of prevention. He brings deep expertise in healthcare system, policy and preventive health strategy. And then insightful and impactful sessions. In his sessions on sustainable healthcare cost reductions, he highlighted that Malaysia spends nearly 40 billion ringgit annually on non-communicable diseases, with up to 60% preventable through lifestyle change, delivered with clarity, agency and engaging style that making complex data easy to understand. So our last speaker is health screening partner, which is Sonobi Ultrasound. Sonobi Ultrasound is health screening service provider with a nationwide presence in Malaysia. So they are aiming to bring health screening closer to the public by providing accessible, convenient and comprehensive health screening solution. Sonobi Ultrasound aims to provide professional ultrasound service, extensive blood tests, and health screening solution to SME, MNC, and government body. So their mission statement is to empower the public with earliest awareness of their health by bringing the latest health screening technology directly to the workplace or the location of the event.
A movement is defined by people who show up. For Well Nation 2026, we are targeting about 400 to 500 attendees. This number is intentionally large enough to create impact, yet structured enough to ensure quality learning. But more importantly than the number is the diversity itself. We are bringing together healthcare professionals, university and college students, NGO representatives, policymakers, and the general public because health belongs to everyone. This makes ensure that every conservation is rich, every perspective is valued, and every solution is holistic. Now let's talk about where this transformation happens. We have secured the Grand Ballroom at the Shangri-La Hotel, Kuala Lumpur, a venue that matches the ambition of the city. It is a pillarless ballroom spanning about 1,509 square meters. No obstructions, no compromises, just a clean, flexible canvas for 500 attendees. The venue comes equipped with a basic AV system, tables, chairs, staging, air conditioning, and Wi-Fi. This minimizes external rentals and keeps logistics streamlined. The built-in AV system is ready for high-impact presentation and video materials. Every message, every statistic, every stories will be delivered with clarity. The real advantages is flexibility. With partitioning system, we can transform this single space into multiple formats. Theater style for keynote speeches, um, classroom setups for interactive workshops, open floor for health screening and community games. One venue, 3 days, infinite possibilities. Now let's talk about the class format. On the first day, we begin with plenary sessions in a theater style setting. Experts take the stage, knowledge is shared, but we don't stop at listening. In the afternoon, the room transforms into a classroom setup for the interactive Six Pillars Challenge game. Learning become active and participants leave with knowledges they can actually use. Day 2, life-saving skills. The morning features a keynote and a live demonstration on stage, but the afternoon is where the real transformation happens. We clear the floor and create an open practice area. Participants gather in small groups, rotating through stations and with mannequins and first aid equipments. They don't just watch CPR, they perform it. They don't just hear about the Heimlich maneuver, they practice it. Confidence is built through actions. On day 3, the final day, we adopt an open floor format. Screening booth line the perimeter, blood pressures, BMI, glucose checks, all provided by Sonobi ultrasound. The center of the room offers seating for sharing sessions and interactive games like Know Your Numbers and Health Detective Challenges. Early detection is no longer a clinic visit. It becomes a community event. It becomes normal.
Next, we will talk about the budget summary of the Wow Nation 2026 Summit. Our total estimated cost will be around 496,500 ringgit, which sits well with our client's budget range, which is around 400,000 to 600,000 ringgit. The budget cost comprises of these item descriptions, which are the venue, catering, and audiovisual for 500 people, which costs up to 122,500 ringgit. Our venue would be the Grand Ballroom of Shangri-La Hotel, which has all the amenities, catering, audiovisual equipment, PA system combined in one package. Next is the on-site health screening, of course, for 500 people, which amounts to 262,500 ringgit. Next are the first aid trainers for the first aid team demo. It costs to 80,000 ringgit for the whole summit. Next are the speakers and trainers fees. For the specific cost to each speaker and trainer, it is in the proposal, but in summary, amounted is 23,000 ringgit. For the equipment, logistics, souvenirs from our side, it will only cost up to 2,200 ringgit. Finally, the Sonobi partner fee is 6,000 ringgit, which at the end adds up to 496,500 ringgit. Thank you.